Generally, you want to shampoo 3 to 5 times a week, and you want to use a series of anti-dandruff shampoos that have distinct agents.
Usually a patient would reach for over-the-counter products to begin with.
Salicylic acid is a common ingredient you may find in an over-the-counter dandruff shampoo. It really works by decreasing the amount of flaking and scale buildup on the scalp.
One of the components of the over-the-counter shampoos is pyrethroid zinc, and that's a common component that's used to decrease inflammation, which will result in reduced itching on the scalp.
It helps by being antibacterial and antifungal. We know there are some common skin yeasts that live on the scalp, and in some patients they overreact to those. Selenium sulfide works by both decreasing the amount of flaking that you have and also may help decrease some of those yeasts that live on the scalp.
Coal tar is an interesting element that's used in many different scaling conditions and in different percentages affects the turnover of skin cells as well. So the buildup that you see and the flaking that you see is significantly reduced by coal tar. It used to be not a very elegant element of products, but now through pharmaceutical marvel, it's a very effective treatment. Using 2 different sources of control, one that would reduce the cell turnover and one that would reduce the yeast element, would be very reasonable.
70% can be controlled with over-the-counter remedies, and you don't have to write a prescription. If it's not responding to over-the-counter medicines, then that's the time you want to seek attention.
The first line of therapy are the antifungals, and you have ketoconazole and cyclopyrox.
The ketoconazole can be a 2%, and that requires a prescription. The 1% preparation is over the counter.
Sometimes the problem needs a little bit more of a powerful component, and the doctor wants to give a steroid. There are a lot of steroids. Clobetasol is probably the most popular one. The reason you have these different forms is just gives people more of a choice in the treatment.
I say keep it simple. We call it KISS. The easiest, simplest regimen that's going to keep the dandruff under control is the best regimen. It's a chronic process. It comes and goes. You cannot cure it.